Prosecuting Authority is studying the findings of the Life Esidimeni inquest. Now, the High Court in Pretoria yesterday revealing the outcomes of its investigation into the deaths of over 140 mentally ill patients. They were transferred from Life Esidimeni to other facilities, and these were unregistered and ill-equipped non-governmental organizations, or NGOs for short, as part of a cost-cutting measure by the Gauteng Health Department. Now, the judge finding that the former mental health director, Dr Xoli Mngambi, and the ex-MEC, Qetane Mahlangu, were negligent, leading to some of the deaths. Now, the NPA says the matter is not necessarily trial-ready and that further investigations may need to be carried out. Well, the Minister of Health, Dr Aaron Motsoaledi, joining us this evening. He's calling for legislative changes to make mental health patients the responsibility of the national government. He joins us now to expand on that particular suggestion on the legislation. Minister, good evening to you, and thank you very much for your time. Minister, I know we've called you for this particular discussion. We'll get to it in a moment, but some sad news coming in this evening that the former Bafana Bafana coach, Stan Screamer Shabalala, has passed away. I'd like to give you a moment to just reflect on this.
Oh yes, Xoli is an end of an era. I'm extending my heartfelt condolences to the family. We all know Screamer Shabalala. He was Mr. Soccer himself. Whether he was in Bafana Bafana or in Orlando Pirates or in any club, he was associated with Mr. Soccer. So the country has lost. May his soul rest in peace.
Minister, I thank you very much for those words. Let's then get into this conversation. You are suggesting that mental health patients should be the domain of national government, or should we say the health ministry at national. Why is that your position?
I'm not suggesting, Xoli. It's actually one of the recommendations of the health Umbad, Professor Malagapuru Makgoba. You'll remember that when this saga started, I rushed to the health Umbad to investigate what has happened. And he did so, and he wrote recommendations which were being implemented. One of them was this issue. He was not saying mental health must directly be at national level only. What he meant, Xoli, was that if you look at the Health Act, the Mental Health Act, before 2002, what has happened in Life Esidimeni would not have happened, because it has happened because before 2002, the mental health, I think it was enacted in 1977. I'm not sure about that. I need to go and check my facts. Was that if any mental ill patients have to be transposed from one area to the other, the state president himself has to put his signature. You'll remember that in the past, when you grew up, there used to be mentally ill patients who were classified as the state president's patients. And you'll remember that offenders was one of those. So they could not have moved without the signature of the president, not even the minister. Now, in 2002, when the National Health Act was enacted, there was an argument which might have been justified, which said, but the action is taking place locally, on the ground, in provinces. Why should a decision be taken up so high at the level of the presidency? So in that act, the powers of the president were taken, not even given to the minister, but given to MECs in the province. And Professor Malagapuru Makgoba was saying that should not be allowed to continue. So it's not me at all.
Yeah. I'm glad you mentioned the name of the Professor Malagapuru Makgoba, because it was through that very investigation he conducted in his capacity as Health Ombudsman in 2017 that his report came out, and I'm just going to quote one element, one small element from it, when he says the Gauteng Department of Health ran the transfers, quote unquote, without dignity. And he went on to say last night that this was as a result of the arrogance by officials in Gauteng, where politicians sought to overrule the suitably qualified people in the department in order to justify their ends as to why they needed to do this. How do you respond to those comments that political interference was actually the problem here, because the officials down below, pressure was exerted on them in order to fulfill what this Gauteng government wanted to implement in 2016?
Well, I won't call it political interference, Xoli, because a decision was not taken by officials such that somebody who's a politician came to interfere. The decision was taken at the political level itself. But despite the fact that there are experts who said no. Usually, Xoli, when you do things like this, you ask for expertise. Even us who are doctors, I mean, let's look at Professor Malakaburu Makhoba himself. He was a professor of medicine. But when he was given this investigation, because he's not a psychiatrist, he went to look for 6 specialist psychiatrists to help him and advise him. That's how we generally do this type of things. I, as the minister, if I want to take a decision, for instance, about maternal health, I look for experts who form a committee about maternal health, who will make such decisions, so that it's not me at the political level who makes this decision. The other example I can give, Xoli, is the issue of kidney transplant. Nobody gets a kidney transplant without the Minister of Health signing that transplant must take place. But the Minister of Health is not a nephrologist. He might be knowing medicine, but he doesn't know a lot or deep information about nephrology. So there is a committee headed by a professor who will write a recommendation and say, yes, this particular transplant must be performed, or who may say, no, we are not agreeing. And the minister will base their decision on such advice.
Yeah.
So I'm just saying, generally, you need to get advice from those people who specialize in that field. Otherwise, you'll take wrong decisions like this one of Life Esidimeni.
Final question to you, Minister. You know, at the moment, the National Prosecuting Authority says it is studying the contents of the outcomes of the inquest, and this is with a view to possibly charge criminally the officials that were mentioned in this report. My question to you tonight is, what would be the appropriate punishment be for officials who simply took it upon themselves to shove aside human decency, human dignity for the most vulnerable of our society?
Xoli, all we want is justice. Justice for the families of the deceased and the deceased for themselves. It's not for me to mete out a sentence because I'm not trained in that field. Again, I'll make a terrible, terrible mistake based on my feelings. I believe the judges, the courts are well placed to make this type of ruling. Just like the inquest was done by a judge who is qualified. If you remember, Professor Makhoba himself recommended that there be a mediation which must be conducted by a prominent member of society or a judge, and we went for the former Deputy Chief Justice, Dikgang Moseneke, to do that. So you need experts to decide on the area of expertise. And this is the area in which I don't have any expertise. I believe the NPA and the judges will guide.
Yeah. Perhaps as a parting shot, Minister, Professor Makgoba last night says he doubts very much that there has been any change or lessons learned from the 2016 tragedy of Life Esidimeni. And he bases this on what he says is 50% of his recommendations not having been implemented relating to this matter. So you have your work cut out, don't you?
Yeah, I do, but perhaps the professor might not be knowing why some of the, I don't know which ones he said which were not implemented. For instance, this particular one about changing the act, the department did set up a team. As I said, we always put together experts, and they were advised to look for legal advice from senior counsel. Senior counsel brought the advice in the department. Well, of course, I was already gone, but I'm made to understand that there was an advice from senior counsel who noted that the NHI Act is making far-reaching recommendations about the reorganization of the healthcare system, including certain things which need to happen nationally, at the national level.
Yeah.
So he then said, look, instead of doing piecemeal, because there are going to be consequential amendment to 9 acts. In other words, the NHI Act leads to consequential amendment to 9 acts. And he said they must wait for that, otherwise they'll be doing things piecemeal and it may become messy. And they were waiting for that. You are aware that the president only assented to the National Health Insurance Act in May. So the job now is to go on and do the consequential amendment. That will include many of the recommendations of Professor Makgoba.
All right. Minister of Health, Dr. Aaron Motsoaledi, thank you very much for your time.